Hello everyone, welcome. Today we're going to talk about the anticoagulation in mitral stenosis. So I hope you all know about the mitral stenosis. Let me show you a picture. Here you can see a echocardiogram, which is like basically an ultrasound of the heart, and you can see the heart chambers. You can identify the chambers here. This is the left atrium, this is the right atrium, this is the left ventricle, and this is the right ventricle. And here from the left atrium to the left ventricle you can see these are the mitral valves, and here from the right atrium to the right ventricle you can see the tricuspid valves. But the striking point here are the mitral valves. They are thickened and they are not opening, so they are immobile. So this is the classic pictures of the mitral stenosis. And here you can also see that the left atrium is a bit dilated, which is also a bad sign. So the goal of anticoagulation in mitral stenosis is to prevent the formation of left atrial and in some cases the right atrial thrombus. And if you prevent the formation of thrombus, the risk of thromboembolism will be low. So this is the goal of anticoagulation. Now let's talk about why thrombus forms in mitral stenosis. The idea here is in mitral stenosis the mitral valve is immobile. The valve area is reduced, so that's why the valve cannot come from the left atrium to the left ventricle very well. So the blood backs up, or blood stasis occurs in left atrium, and the left atrium gets dilated, and it can, or it might or might not result in atrial fibrillation. And this combination of left atrial dilation along with atrial fibrillation actually increases the risk of formation of clot or the thrombus inside the left atrium. So here are the list of indications where you want to use the anticoagulants in a patient with mitral stenosis. So the number one indication is atrial fibrillation, and remember that the VAS score is actually for non-valvular atrial fibrillation. So whenever a patient with mitral stenosis has atrial fibrillation, you must use the anticoagulants. The other indications are also straightforward. You have a patient with left atrial thrombus, you must use anticoagulant to dissolve the thrombus, and also the patient having history or an acute attack of systemic and pulmonary embolism should also be treated with anticoagulants. The other indication is the left ventricular systolic dysfunction. This is also a high risk factor for development of the thrombus and also a thromboembolism. So here you can see another echocardiogram where you can see a thrombus inside the left atrium. Here this is the left atrium, and here you can see this, the white dense area is a big thrombus in the left atrium, so it's very high risk thrombus which can actually lead to thromboembolism. The commonest drugs used in mitral stenosis as anticoagulants are oral drugs like warfarin, but you can also use newer drugs like rivaroxaban, apixaban, etc. And the target INR with warfarin is usually 2 to 3. So those are the basic ideas of anticoagulation in mitral stenosis, and there might be a lot of side effects, especially with warfarin, because the warfarin, if you cannot control the INR well, if the INR is high, then there is a risk of bleeding, and you should avoid using warfarin in pregnant patients, especially in the first and last trimester, but you can still use them in the mid trimester very well. So those are the basic ideas of anticoagulation in mitral stenosis. Thanks all for watching my video.